I am Dr. Dodson, and I am one of the dental hygiene faculty. And today we are going to talk about the dental hygiene profession, something I know that all of you are obviously interested in. So when you look at the definition of a dental hygienist, you see some key words here. Oral health professionals, prevention, treatment, to protect the teeth and gums, to protect the patient's total overall health. Nowhere in there do you see anything about a cleaning lady, or man for that matter. You do much more than that. You are the person who is the eyes for oral cancer in the practice. If you miss it, chances are it's going to be missed. You are the person who educates the patients. You spend more time with them than anybody else in the office. So if you don't take the time to do a very thorough and effective job of patient education, it won't get done. And you are the person who is the face of the practice in a lot of cases, because you're the person that everybody likes, that everybody looks forward to coming to. You're the person who builds relationships with generations of a family. So you're often the person who represents that practice. You are not just an extension of the dentist. You are a member of a healthcare team, and your contribution is unique. So keep that in mind, that you are not just the cleaning lady. Yes, you clean teeth, but there's a lot more to it than that. And you will also notice that there's a word on there called accredited. Dental hygiene programs have to be accredited, whether they're in a community college, whether they're in a university, or whether they're in one of the proprietary schools. And the proprietary schools have just come about in the last few years, and those are schools that have a business model. Their objective is to make money through educating students. So they take a lot more students, they turn out a lot of students quickly, they charge a lot of money for tuition. So in some ways you're a little more likely to be able to get into a proprietary school, but you're going to pay a whole lot more for it in the end. And they're all accredited. So I'm not saying that proprietary schools are bad, because they have the same accreditation standards that we have. But one thing they have done is really flood the market. And we'll talk about that in a little while in terms of your job outlook. So you attend an accredited school, hopefully you pass, and then you take a national written board and a regional clinical board. And then you become a licensed RDH, which stands for Registered Dental Hygienist. And you can do that with an associate degree, or you can do that with a BS degree. Here it happens to be a BS degree, which I know many of you who work very hard to get there, taking all those blasted general education courses and so forth. You can work not only treating patients, you will be able to work as an educator. With your BS degree, you'll be able to go into a community college and teach dental hygiene. You'll be able to teach clinically anywhere that offers dental hygiene, even a university level. You'll be able to go into public health, you'll be able to do research, you'll be able to do program administration. There's a lot of things that BS is going to open doors for you to do. So it's not just a matter of always working private practice chairside. That may very well be where the majority of our students end up, because that's the model that we practice under right now. But you don't have to stay there forever if you don't want to. You will have options with your BS degree, which is nice. So every state has its own regulations. Yes, teeth are the same all over the country, but the states haven't figured that out yet. So you will have different exams for different areas of the country to get your license, even though it's the same basic skill everywhere. And you may or may not be able to do the same things in various states. Right now in Tennessee, you can do local anesthesia. You can numb up your own patients. You go across the state line to North Carolina and you cannot do that. Maybe someday it'll all be universal, but right now it isn't. Types of services. You are the prevention expert in your office. You are the educational expert, and what you do is also therapeutic in that you are preventing or managing oral diseases. You're going to do assessments. That's a big part of what you do. Review of the patient's health history, and you're the one who does that. The dentist doesn't come in behind you and say, okay, tell me what's new with your health history. It's up to you to do that. So that's a pretty big task when you think about it. So you have a lot of responsibility as a dental hygienist and a lot of talent. And sometimes that talent's underutilized, and we'll talk about that. Dental charting, oral cancer, evaluation of the health of the gums and the teeth. X-rays, which allows us to look for dental caries as well as any other things that may be abnormal. And this is what the cleaning lady part is, the removal of calculus or tartar from above and below the gum line using dental instruments. So a big part of your training is learning the manual skills, the technical skills of using all those dental instruments, all those assessment tools, learning how to put it all together and give the patient the best service possible. You're also going to be doing things that are both preventative and therapeutic, like fluoride and sealants. And sealants you may or may not know about, but this is a very big skill that you want to get very good at, because you can make an office a lot of money and prevent a lot of dental caries if you are good at doing sealants. And again, the local anesthesia and or the nitrous oxide. You are going to be licensed to do that. And educating the patients is one of the biggest things you do. Counseling them on how to take care of their own mouth. Motivating them to do exceptionally good patient care every day at home. It's not just coming to your dental hygienist every 6 months that gives you a healthy mouth. It's what you do at home every day. And smoking cessation. If you don't do this, no one else in your office will. If you see tobacco users and you never mention to them anything about the facts as they are as to why they should quit, and that you're able to help them do that, no one else in the office will. This is another thing that's going to come to you. And of course, you may or may not appreciate that helping somebody break a tobacco habit is one of the best things you could ever do for them. That will make a world of difference in terms of their health for many, many years. And nutrition is another aspect. No, you are not nutritionists. No, you are not dietitians. You cannot prescribe a certain diet. You cannot get into calorie counting or dieting or anything like that with your patients. But when you have somebody who has 14 carious lesions in their mouth, for example, you may want to take a look at what it is they're consuming and how often they're consuming those sugars and sweets and things that contribute to that problem, and help them to find their way to a healthier diet. You might work in a private dental office, you might work in a school, a public health clinic, a hospital, some other type of healthcare organization, a correctional institution, a nursing home, or in a corporate environment. So you may do a clinical role in any of those places, or you may do an administrative role in any of those places. Dental hygienists tend to be very good with details. They tend to be very organized. They tend to pay attention. They're often exceptionally good students, and that's because they are aware of what's going on. They pay attention, and that makes a good administrator. So you may find yourself being an administrator someday. And in a few of the states, you may even end up owning your own practice, because that is doable now in a few places. So RDH means Registered Dental Hygienist. These are the credentials. These are professional licenses that identify you as a health professional. And we've already said something about that nasty written exam and the national regional exam. And if you happen to end up in Indiana, it's LDH instead of RDH, but it means the same thing. Now, we have said state license requirements typically indicate that you graduated from an accredited school. That is not true in Alabama. That is the one state that is different. Anybody here from Alabama? Alabama dental hygienists can be trained on the job. Yes, shocking, isn't it? Yes, they can be trained on the job, and they are paid very little, and they don't necessarily have to graduate from an accredited school. Dentists in Alabama somehow have continued to get away with being able to just hire off the street, basically, and say, here's your instruments, let me show you how to use them, and then book the patients. So when you are in this program and you are learning all the things that you're going to learn, it's going to shock you even worse to think that somebody somewhere just walked in and picked up instruments and started basically cleaning somebody's teeth. So appreciate that you're in Tennessee. Appreciate that you are where you are and that you're going to get a good education and you're not going to be dangerous when we let you out of here. So let's talk a little bit about the career outlook. I'm sure you're aware, and probably this is one of the things that attracted you to the profession. Dental hygienist is a pretty lucrative profession. They make relatively good money, particularly if it's just a 2-year, and I don't mean to downplay that, but because we know a 2-year degree isn't never just a 2-year. Often it's a 3-year degree, even at community colleges for dental hygiene. But there are very few professions that will allow you to make what you make with a basic 2-year license. Dental hygienists in the state of Tennessee will average about $62,000, which comes out to about $30 an hour. Now, that doesn't mean everybody's going to make $30 an hour, especially starting out. And this is average. So you know there's going to be parts of the state that pay significantly less. And there will be parts of the state that pay significantly more. And hopefully, maybe by the time you get your degree, it might be even a little higher. Now, about that market outlook for dental hygiene, it depends on who you ask. If you look at the Bureau of Labor Statistics, the outlook is just fabulous. But a more realistic outlook comes from the American Association of Dental Educators. And they've looked at the number of students coming out of schools every year, particularly since we started with the proprietary schools, and looking at the number of potential employers being dentists. In the current model, dental hygienists primarily work in private practice, meaning if you have a lot more dental hygienists than you do dentists, then it stands to reason that dental hygienists aren't going to have as many choices about where they work. And that seems to be what's happening in our profession as we speak. ADEA, American Dental Educators Association, says we're putting out somewhere in the neighborhood of 1,000 to 2,000 too many dental hygienists in this country a year compared to the number of dentists. And the Health Resources and Services Administration says we can expect a dentist shortage in the next decade. But now, before we get all distressed about that, even though we have a shortage of dentists, supposedly, do we have a real shortage or do we have a lack of access? Seems to me there are plenty of dentists in the metropolitan areas where they can set up a practice and make good money because they have to make good money to pay for that, those loans and that office and all that equipment. But we don't have too many dentists by any stretch in our rural areas and our inner city areas. 50% of Americans do not get dental care. So we have a tremendous issue with lack of access. And what I think we're going to see happen is we're going to see the fact that we have very talented, very capable people who are able to do lots of things for people for their oral health, underemployed or unemployed, and 50% of Americans not getting oral health. I think that's going to propel us toward a new model where dental hygienists are better utilized. Slowly, state legislatures and policymakers are beginning to see that dental hygienists can do a lot more than what we've been allowing them to do in the current work model. That we should think about moving toward that mid-level practitioner like nursing did many years ago with a nurse practitioner. With just a little bit of additional training, you can move into something called an ADHP, Advanced Dental Hygiene Practitioner, and you can do some of the very basic things, simple extractions, simple restorations, and all the prevention stuff that you already will be able to do as a dental hygienist, and then refer those more difficult cases on to the dentist. Minnesota has started doing this. They've turned out the first class of mid-level practitioners, and they have licensed them to work in the state of Minnesota. So we're hoping that that's going to be something that catches on across the country. And then the other thing is that we now have about 35 states that are allowing dental hygienists to come out from under some of that strict supervision and work in a more collaborative environment. In other words, collaborating with dentists instead of having direct or general supervision, so that you can go into places like nursing homes and schools and low-income housing situations, or health departments or community health clinics, places where people don't get seen. And even if you're just doing a screening and a referral, think of the good that you can do. So it's an exciting time to be going into dental hygiene. It's a bit scary in that change is always a little frightening, but what a great time to be looking at getting a degree in dental hygiene and perhaps moving on up into education or the ADHP, or moving into an underserved area and really using your skills to help people who are very, very deserving but otherwise would not get dental care without you. Then there's that pesky issue of getting into a program. Getting accepted, getting your foot in the door, and making that first step, which is getting your license. We will get probably 100 plus applications for 24 slots. So I don't have to tell you, it's competitive to get into our program. And I know how much you want that BS degree because you have done all this other stuff and you're this close once you get your dental hygiene stuff out of the way. If you should end up in an associate degree program somewhere, that's okay. Go ahead, get your license, be proud of your associate degree, and then come back to ETSU and complete your BS online. We have one of the first and one of the strongest BS degree completions in dental hygiene in the country. We started in 2001, was our first class, graduated our first group out in 2003, and we graduate students out every year with their BS in dental hygiene. And this is for the working hygienist who has an associate degree who wants to come back and do their BS online. And so all it involves is 17 or 18 hours of online classes plus whatever you lack in your gen ed core, which for most of you probably won't be much. And then if you're taking classes at ETSU especially, then you've already got university hours. So if you get your associate degree at a community college, it doesn't matter. You're going to be just sitting pretty when it comes to finishing that BS. So that is an option for you to keep in mind as well. questions do you have for me? We'll give you a few minutes to think as well, because Megan, who is your advisor, has got some things to share with you, and I'll just kind of step aside and then we can answer questions when she's finished. Okay?
So basically, briefly the curriculum, but any questions? Or I know you were asking about the interview or anything like that. This may be the time to do so before we just talk about the curriculum needed. I know a lot of you are getting close to application, it sounds like. So there's more people getting close to application than needing to go over the curriculum. So if you have any specific questions like that, probably be a good time to ask that.
Somebody said that when you applied, they didn't look at your overall GPA. They just took your science and your math percent. Is that true, or how does that work? The overall?
You look at overall.
Okay, that's. I look at that.
Mm-hmm. But we look more closely at your science. So we have two categories. It's a check sheet and it's point system, and we will look at your overall GPA and give you so many points for that, and then we look at your science GPA and give you so many points for that. Studies have shown that students who do very well in A&P1, A&P2, micro and chemistry are more likely to pass their national dental hygiene exam. So that's why we look so heavily at those courses. How did you do in them? How many times did it take you to do that? We look closely at those, but that's not the only thing we look at.
Do y'all take into consideration like involvement, like in clubs and
Service, community service, how active you've been. We want a total student. Yeah, it's not, 4.0s are not going to get turned away, typically. You know, if you were 4.0, a 3.9, a 3.96, a 3, you know, whatever, you're going to be pretty much an automatic because your chance of success is very high. In other words, we're not going to take somebody with a 3.2 who's involved up to here over somebody with a 4.0 who spent their time studying and they didn't have time to get involved.
okay.
However, we like to see community involvement. We like to see people who are going to be involved in their communities. We like service-oriented students. We like students who, for lack of a better word, are more complete, because that tells us two things. You find the time to get things done, and therefore you are better able to organize your time, and you get along with people. And a whole lot of dental hygiene in the dental profession is getting along with people, working in a team, and liking people, and being approachable, and being able to talk to people. That's important. Now, if you're the shy type, don't worry, we understand. We have a lot of shy types in dental hygiene. You don't have to be comfortable standing up in front of the classroom to be a good dental hygienist. But most of the time, dental hygienists do their best work when they are warm and caring and approachable and can communicate with people well. And that involvement gives us that piece.
How many hours of, I can't think of the word, but like, shadowing do y'all look at?
There's not a magic number. More is better.
Okay.
Simply because going once or twice a week one time doesn't teach you what going several times over the course of a summer, or even having worked in a dental office. It's important that you understand what you're signing up for. You know, we want to know that the dental hygiene world isn't all glamour. You know, you're up to your elbows in blood and yuck sometimes. You know, you work with people sometimes who really aren't nice, and you have to deal with that. So it's important for you to see a number of things done in the dental office. It's important for you to watch possibly more than one dental hygienist and see how they operate and how they differ in their approaches a little bit. The more you know about the profession going into it, the more comfortable we are that, yeah, this is something you really want to do. You know what you're getting into and you still want to do it. That's what we're looking for with those shadowing hours.
Can you explain the clinical board? What does that entail?
I don't want to scare you. And you'll be ready for it when it comes. But it's pretty intense. You have to take a patient with you that meets very specific requirements. In other words, they can't be too easy and they can't be too hard. So you have been given a booklet with exactly what you need to do, what kind of person you need. So the first big hurdle is convincing someone that's just the right person that they need to go do this with you. And you take them with you and you will clean them. You will have 3 people checking the patient, and then you'll have 3 people checking them again when you're done. And then your whole life is in the palm of the hands of those 3 people. And they will say, yes, you did well, or no, you didn't. And the thing for you to remember is, this may or may not be a good indication of how good of a dental hygienist you are. We've had some of our very best students fail the clinical boards, go back the very next week to a different site, and pass with flying colors. And not much changed in that course of that 1 week. So I'm not a big fan, as you can tell, of the way our clinical boards are done, because I think there's just too much riding on that one patient, one day experience, because any of us can have a bad day. And then to think that you're not going to get to pass and you've got to pay another $1,000 or so to take this test again because you simply had a bad day. And then if you move to North Carolina, you have to take again another blasted test, or California, or wherever. The way the whole thing's set up really makes me uncomfortable, because it's really not fair. But it is the way it is. And states make a lot of money off these exams, and we're kind of at the mercy of state licensing boards. So we jump through the hoops and we get you as well prepared as we possibly can. You go with the best patient we can possibly get you. You go as prepared as you can go, with the attitude of, I'm going to do my best and that's all I can do. And most of the time everybody passes, but occasionally somebody doesn't, or maybe a few people don't. And then they take it again. And they hopefully pass it the second time, and if not, then they take it again. But you will pass it. It's just a matter of how much gray hair you collect in the meantime. So it's one of those things you just have to say, it's going to be worth it. It's going to be worth it in the end. It will.
Is there a limit on the number of times you can take it?
I don't think so. I think they'll continue to take your money as long as you want to take that exam. At least if there is, we haven't had anybody find the limit yet. So
it's not that bad.
yeah, it's not that many. So
Well, let me briefly go over just the curriculum with you. Think about some more questions you may have, and then we'll go back to kind of a question and answer style. Thank you. Okay. So I just wanted to show you when the projector pulls up. So why this is pulling up. So I just wanted to show you the curriculum that you typically need to have for your first couple years here. A lot of you are reaching kind of almost done with it, sounds like. But registration is also coming up, so I wanted to let you know about that. So for those of you that have not met me, my name's Megan Roberts, and I'm the pre-dental hygiene advisor here. So you'll meet with me for the first couple of years, and then Dr. Faust once you get into the program. So basically, the curriculum that you need is general education. It's Our general education is quite intensive, so I'm not going to go through all of that because it'll take me a little bit to go through that, but I will meet with you over a 30-minute appointment if you're confused about any of that. So general education is typically your Englishes, your literatures, histories, math, all that good stuff. And then the sciences that you specifically need for dental hygiene is your AMP1, your AMP2, that chem survey, and intro to micro, okay? And then in addition to general education, there's also the principles of nutrition class as well, okay? So for those of you that don't know that, I just wanted to make sure you do know that on top of general education, there are some specific prerequisites that you need for our program to be eligible to apply online. And then when you are coming up to application, you would just apply through the website under dental hygiene. The application is not going to be posted here until January 15th, but it'll all be online for you in the spring semester. It's only eligible to apply every year in the spring, okay? So there's no fall applications or anything like that. So you will apply in the spring, and then you will start the following fall semester. So the next application will be coming up this January 15th, and then it'll be posted on here, and then you will hear back from the program about an interview, kind of April, typically in April, and then towards the end of the semester about whether you got accepted or not. Okay. So again, my section is just real brief. Spring registration is coming up, so I'm going to send an email very shortly, probably after fall break, about coming in for spring advisement. And then you will start signing up for classes for the spring in November. So it starts with grad students and trickles all the way down. So yours, freshman, sophomore, will probably be mid-November when you can start registering for classes. But I'll send out an email about coming in to see me very shortly after fall break. And then you will sit down with me for a 30-minute appointment. We'll talk about what your spring semester is going to look like. If you have any specific application questions, then too, I can help you. Okay?
And it's great that you have this opportunity. It's nice, very nice that Megan carved out this time and gave you all an opportunity to come in for this, because the more you know, the better you can prepare yourselves, the more you can take classes that you need instead of just something that is going to occupy space in your schedule and then you've got to go back and take something else. So it's good to ask questions and get good advisement. It makes a big difference.
It's nice to have Dr. Dotson here too to talk about, you know, the application and, you know, what that process is like too, because she sits in on the committees and stuff like that. That I may not have much exposure to, but she is more than willing to help you out with those questions, because I know I field a lot of those questions, but again, I'm not there sitting with you on that interview.
And the interview really isn't bad. You come in, you're all going to be in the other classroom usually, and we call you out one by one. Each one of the faculty members just rotates in and out, picking up students, and we spend about 15 minutes with you. Unless you get Dr. Hobson, then it's an hour. You'll understand. And it's really a fun day, because we get to know you a little bit. We'll look at your application, give you a chance to explain anything you want or add or tell us anything you want. And then we all sit down. Dr. Faust makes most of the decisions because he's the program director, but we usually have a few slots that we'll lobby for our people that we've interviewed, you know, to get our people in. So we're all kind of, I want this one, no, I want that one, no, I want this one, knowing that, you know, they're all fabulous. We can't go wrong. So, and it's always heartbreaking because we have so many great applicants and only 24 slots. And we have lots of people who apply more than once. You know, if they don't get in the first year, maybe it's because they didn't have their sciences done, or maybe it's because they needed to go back and do a little work to pad their GPA a little bit, or, you know, go get some more something to increase their application scores. And we do have people apply a number of times, and sometimes they get in on that third or fourth try. I mean, it's pretty remarkable how determined and patient some people are with this process. But keep in mind too that although we don't want to lose you to another school, there are other programs. So if you're wise, you apply to several places so that you have a better chance of getting in somewhere.
And it doesn't put you an additional year behind, because remember, applications only open every spring. So there's a lot of times, like if you don't get in, I would be more than happy to meet with you, and I typically do, but we typically have to fill your schedule with advancing your application for next time, finding a minor, maybe finding another backup plan so you're not postponed for graduation even further type of deal. So again, it is wise to apply for more than one program, just because if you're at the point where you're eligible for our program, you may not get in here the first time, but that doesn't put you a year behind. If you do have to reapply, you could start another program as well. We'd love to keep you here, obviously, but we know that it's important to get you a degree of some sort, whether it's an associate or a bachelor's.
How many people typically get interviews?
There's usually about 60. Usually about half of those that apply.
Do you have to major in dental hygiene or can you major in biology?
To graduate and work as a dental hygienist, you have to major in dental hygiene. So, but I think you're pursuing another field in healthcare. So your first couple years, you can try to get the prerequisites that you need for whatever area. So if it's like dentistry, you can try to get those prerequisites and then start our dental hygiene program, graduate, become a dental hygienist, and then possibly go back to school for whatever other area professional school too. So that's a possibility, but your freshman, sophomore year, you obviously need the prerequisites for dental hygiene on top of general education. So it's even more difficult to find, time to take those biology and chemistries that you may need for something else. So you have to be pretty set on being a dental hygienist.
Yes, you have to remind yourself often, this is what I wanted, this is why I'm here.
When do the clinicals start once you get into the program?
They start right away. Your very first semester, you will have something called preclinic lab, and that's where you learn to use your instruments. That's where you will work on each other most of the semester. And then in the spring, we'll finish up with all the technologies and everything that you're going to need to know in order to see patients. You will start seeing actual patients usually the end of February, 1st of March of your second semester. And those are 4-hour appointments. So people typically bring people who like them a lot, because it's hard to find somebody who's willing to give up 4 hours of their life to sit in your dental chair. But you're very slow. When you start at first, you're extremely slow, and we want to give you plenty of time because we want you to be good. One thing I didn't say that I should have said is that our students get jobs. Even when the job market's not terrific, we generally don't have students that are unemployed. They may take a while to get a job. They may not get their dream job right out of the gate. But generally, if our students want to work, they do, because we have a great reputation in the dental community for turning out excellent students. Dentists like our students. And it's because we're so hard on you. We love you. We will not disrespect you, and we will not make you cry for no reason, but we're hard on you. When you come out of our program, you're going to be good, and you're going to be self-confident, and you're going to be employable. We feel like we owe you that. So, yeah, you're going to get into clinic right off the bat. And you're going to spend a lot of hours, like 1,000 or so, in the clinic by the time you graduate. So you're going to be good at what you do.
When you get close to graduation, do they have you job places that kind of help you, or is it just?
Sometimes dentists call us for recommendations. The local Dental Hygiene Association has a job placement person that knows about open jobs in the area. We have a class called Issues of Dental Hygiene where we work on resumes with you and issues pertaining to getting into the working world. But as far as actual placement, no, we don't necessarily take it upon ourselves to place you in an office, but we try to give you the skills that you can really have a good resume and interview well and get out there and get in the job market and be working where you want to work. And I might say that those 4-hour appointments won't last forever, that, you know, come midsummer or so, we start to chop them down, and eventually you get down to 2-hour appointments. And eventually you get to where you don't need the whole 2 hours. You know, when you graduate, you'll be seeing easy patients in about an hour. The same thing you will be doing in private practice. And I think that is one reason why dentists like our students also, because they can get the job done and do it well and do it efficiently. No, you're not going to be able to be as fast when you graduate as some people practicing in the field that have been there a long time, but you will have that potential. You know, you're not going to be married to that 2-hour appointment forever. You're going to realize that, you know, that's going to go. I've got to figure out how to do this faster, and you will. And you're going to be amazed at what you learn and how much you grow. It's just so neat to watch it happen. You come in, you're scared, you're not sure of yourself at all, and you know, you're picking up the first dental instruments and going, oh, I don't know what I'm doing, and then by the time you graduate, you just do it. Your hands just know. You don't have to even think much about it. So it's really neat. You've got a great faculty here. You've got a great faculty, great clinical faculty. You got some clinical people with a lot of experience. So we're all different. That's one thing you're going to marvel at how you're getting 5 or 6 people that are totally different. But the neat thing about it is we all bring a different set of skills, which is very cool. It's very helpful for students. Have we sold you on ETSU? You were probably already sold before you got here, right? Yeah.
If you don't have any other questions, you guys are good to go. If you want to talk to us individually, that's fine as well. Thank you so much for coming. We greatly appreciate it. Enjoy the rest of your semester, and I will see most of you soon for advisement. Okay? Thank you.
Thank you.